So welcome everyone. Today's presentation is brought to you by WorkWell NYC, the New York City Worksite Wellness Program, and we're here for the Coping and Caring series. So thank you so much for joining us. This will be a live Q&A on breast cancer awareness. Next slide. So before we get started, I just want to talk to you a little bit about WorkWell NYC, your worksite wellness program. Next slide. Okay. So WorkWell NYC is your worksite wellness program, and our goal is to create work sites that make it easier for our employees to live healthy and active lifestyle. We know that health is not just the absence of disease. Health is physical, mental, financial, and emotional. And we know that health exists on a spectrum. We are here for you with health and well-being resources, programs and supports to help you move more, eat well, be well, and take action to prevent disease, no matter where you are on your health journey. So that's your WorkWell NYC Wellness Program. And so we'll just get started and I'll introduce our panelists. So my name is Ayana Mbonu. I am the Be Well Program Manager. I manage the mental health portion of your wellness program. We provide mental health resources and resiliency programming. And so we are joined by Sheila. Sheila Willis is a patient navigator at NYU Langone Health. And we are also joined by Dr. Kathy Ann Joseph. She's the Chief of Breast Surgery at Bellevue. And so we are really honored to have you both here. And so I will hand it over to Sheila to get us started.
Excuse me. Good afternoon, everyone. My name is Sheila Willis. Thank you, Be Well, for inviting us and having us here today to share this important and valuable information to the participants here at WorkWell. So as stated, my name is Sheila Willis. I'm with NYU Langone Health, and we represent a program called the Beatrice W. Welch's Breast Health Outreach and Navigation Program. And next slide, please. So why are we here today? And this program is to inform and enlighten you about good breast health, which enables you to be proactive about your health by reminding you to do monthly breast exams, clinical breast exams, as well as your annual mammograms. The Beatrice Welch's Breast Outreach Navigation program, our mission is to talk to women about the specific risk of breast cancer, to inform women about the available resources for breast cancer screening, diagnosis, and treatment, to present the information to women on how to overcome the barriers to breast care and navigate New York City healthcare systems, and to provide information regarding screening options for those who are uninsured and insured, and underinsured, excuse me. Next slide. So I'd like to start with a icebreaker per se. You'll be on your own as far as picking out, the answers. So here we have an anatomy of the breast, and I would like you to identify the parts of the breast by indicating the number next to the structure. So we have the, on this anatomy, it represents nipple skin, pectoralis muscle, the chest wall, the areola, fatty tissue, ducts, and lob with lobules. So I'll give you a minute to see if you can figure out those locations, and then I can provide you with the answer. So I'll do another 30 seconds. Okay, so I'm going to provide the answers to the anatomy. The nipple is number 4. The skin is number 8. The pectoralis muscle is number 2. The chest wall is number 1. The areola is number 5. Fatty tissue is number 7. Duct is number 6. And lob with lobules is number 3. So hopefully you know the anatomy of your breasts. Next slide, please. So what is breast cancer? Breast cancer is a disease which malignant or can't consider cancer cells form in the tissues of the breast. These images here depict damaged or cancerous cells invading the area of the breast. Early detection means finding and diagnosing a disease earlier before symptoms develop. Next slide. What do we know? We know that breast cancer is the most common cancer among American women, except for skin cancers. About 1 in 8 women over her lifetime in the US will develop invasive breast cancer. The current year estimates for breast cancer by the American Cancer Society estimates that about 276,480 new cases of invasive breast cancer will be diagnosed in women. About 48,530 of very early stage or stage 0 cases of carcinoma in situ will be diagnosed. CIS is non-invasive and it is the earliest form of breast cancer. About 42,170 women will die from breast cancer, and about 2,620 new cases of invasive breast cancer will be diagnosed in men. A man's lifetime risk of breast cancer is about 1 in 883. Next slide. Who is being diagnosed with breast cancer? In recent years, the frequency with which a woman of color is diagnosed with breast cancer has increased. In the past, white women were diagnosed with breast cancer more often than Black women. That has changed. Black women are being diagnosed more often than white women. And one of those reasons is because of us not going out for early screening and detection, as well as just not having the means to be able to get screened, lack of insurance, or not having a family physician to direct them to additional care and services. Next slide. This is the rate of which the percentages of developing breast cancer and the risk of mortality between the ethnicities. So we show the percentages as they stand. Next slide. Risk factors are anything that can increase or decrease a person's chance of getting a disease such as cancer. 90% of all women with breast cancer have no identifiable risk factors. There are many known risk factors for breast cancer. Some of these can't be changed, but some can. Next slide. What are the breast cancer risk factors? The main risk factors for breast cancer are things that you cannot change: being a woman, getting older, and having certain genetic changes. Other risk factors include race and ethnicity, certain inherited genes, family history, breast density, certain benign conditions, starting menstrual cycles before age 12, and going through menopause after age 55. One other thing that is not listed is smoking. Smoking is a definite risk factor for breast cancer. The increase in risk may be because of longer lifetime exposure to the hormones estrogen and progesterone. And this is referring back to the last point of going through menopause. Next slide. Other additional risk factors is hormone therapy after menopause, alcohol intake, obesity, limited or no exercise, not having children. For men, gender-wise, men can develop breast cancer, but it is about 100 times more common in women. It is important to remember that some women with breast cancer, again, have no risk factors. What can you do to lower your risk of breast cancer? Maintain a healthy weight, add exercise to your routine, and that doesn't necessarily mean you have to join a gym for that exercise. It could be something as simple as walking up and down the stairs in your building where you work, something as simple as walking up or around the corner of your block of your where you live, dancing, Zumba, any of those, any type of movement is considered exercise. Limiting your alcohol intake, as well as limit menopausal hormone use. Breastfeeding is also a known adage to help decrease or lower the risk of breast cancer. So women, if you are of childbearing age and it is an option for you to try to breastfeed, it is an advantage to lowering your risk. What is cancer screening? Cancer screening is looking for cancer before a person has any symptoms. This can help find cancer at an early stage. When cancer is found early, it may be easier to treat, excuse me. By the time symptoms appear, cancer may have begun to spread. Breast cancer screening is done with self-examination, clinical breast examination, and mammograms. In some cases, other types of imaging might be ordered, such as a breast MRI, ultrasound, or sonogram. Next slide, please. Who should be screened? Women should have clinical breast exams at least every 3 years, starting at age 20, and every year starting at age 40. So this means basically when you go see your primary care doctor, you should be able to ask them to perform a clinical breast exam or GYN. So it kind of keeps you in a mind frame of being able to do this at least once you see your doctor. Women ages 40 to 69 should have mammograms on a yearly basis. The life-saving benefit of mammograms are clear. Women 70 and older should continue to get mammograms on a yearly basis as long as they are in good health. Please note that there's no screening method for men. However, they should perform self-examination of the breast area along their chest wall. So a lot of men never hardly associate themselves with having breasts, but they do have breasts, and so they consider it their chest, but definitely looking at yourself physically as well as feeling along that area, and as well as under the arm for men. We also take the stand that women, a lot of women who are seniors, considered seniors at age 65, sometimes doctors are advising them they no longer have to go. The stand that we take, or position we take with women who are older, is that they should continue as long as they are in good health, and also if there is some other underlying issue medically, then consult with their doctor, but you should continue to get mammograms as long as you are healthy and able to do so. Cancer, unfortunately, doesn't discriminate on age, and we do have women who are diagnosed at a later stage in life with breast cancer. Next slide, please. Who should be screened? All women should know how their breasts look normally and feel, and report any breast changes to a healthcare provider right away. Some women, because of their family history or genetic mutation, the genetic abnormality known as BRCA1 or 2 increases the chances of a woman getting breast and ovarian cancer. The doctor might advise that you get an MRI or ultrasound along with your mammogram. The number of women in this category that fall into this category are very small. Talk with your healthcare provider about your risk of breast cancer and the best screening plan for you. Next slide. So how do we perform self-examination? You should look at yourself in the mirror, look at your breasts, compare both the right and the left to make sure they pretty much look the same. Look for differences between the right and left as far as skin changes. Feel for any swellings under the arm or along the collarbone. So your chest wall does extend up towards your collarbone as well as under your arm. You will be checking to feel any differences, any lumps, any signs. Also pay attention to your nipple area. So regarding skin changes, if you have an unusual swelling, discolorations, or nipple discharge, these would be definite signs that you should seek medical attention as soon as possible. Please note that these signs do not mean that you have cancer, but it does indicate that you should seek medical attention. Next slide. And here you have a woman who is in a doctor's office preparing for a physical examination, or what is known as a clinical exam of her breast. So most times the doctor will ask you to raise your arms above your head. They'll look for changes, as well as placing hands on the hips. Next slide. So as I mentioned, the doctor will also check underneath the armpit for any changes or conditions under there as well. Next slide. They will also perform the same instance of physical examination with you lying down. As you see, the woman has her hand above her head or arm above her head. And you press firmly. So if you're doing a breast exam on yourself, a self-examination, use your fingers and press firmly into the tissue, the breast tissue, because that's where you will find a change if there is anything to be noted in your condition of the breast. So make sure that you're pressing firmly. Another way that you can also do, which is what I perform as well, is in the shower. I will do a self-check on myself in the shower, and it's a little easier. And I will also do it lying down in the bed. So the best time to do a breast exam on yourself, a self-examination, would be after your menstrual cycle. So 5 to 7 days after your menstrual cycle. Next slide. So you'll perform circular motions on your self-breast exam, as well as an up and down motion. So you'll go from the outside to the inside, and you'll do up and down along the chest wall up towards the collarbone and underneath the breast. Next slide. So it's to review, most importantly, remember that all women are at risk, and getting older compounds that risk. Breast cancer is a problem in our community. Know your risk, get screened, know what is normal for you, make healthy lifestyle choices. Share something today that you learned with someone you care about. Next slide. Thank you for your time and hospitality. If you are in need of support, have additional questions, or know someone that would benefit from receiving this information, feel free to contact myself or program manager Anita McFarland, and these are our numbers. The WorkWell team also has our information. So we are also a screening program. So if you're having difficulties getting your mammogram, we can help with getting you your appointments. We can help if you're having issues with having what is called a referral. If there's no problem that you're experiencing with the breast, we can definitely help with getting you a screening. But if there are some conditions or concerns that you have with regards to some abnormalities or symptoms that you're experiencing, feel free to contact us, because we can also help you and support you with regards to that. If there is anyone here on the call or in this presentation that has been diagnosed with breast cancer, we can also support. We have resources and support information, as well as a one-on-one support that we can help you with, and some additional resources that you might need or find helpful. So feel free to contact us as well. Thank you again.
Sorry, I was muted. Well, thank you, Sheila. That was a lot of helpful and very detailed information. We really appreciate your help. So, Dr. Joseph, I would just wanted to reintroduce you. You are not only the Chief of Breast Surgery at Bellevue, but you're also the Associate Professor of Surgery and Population Health at NYU Grossman School of Medicine. So I want to thank both of you for partnering with us and providing us with this very important information. So I'd like to take this time to ask some questions. In the chat section, someone has asked, what support groups are available for women in treatment or post-treatment?
You want me to answer, Dr. Joseph?
Sure.
Okay. So there are a number of support groups that are available. The number one being that is a 24-hour support group that you can do by phone is the American Cancer Society. Let me just give you their number. Sorry. I have it here. I know it by heart, but I want to make sure I give the right number. So the American Cancer Society has a lot of resources as far as support goes, and their number is 1-800-227-2345. There's also the organization called Cancer Care, which has, they also have support groups. I know they have a lot of online support available. They do have telephone support, but it is during business hours. But they do have online support groups now. They offer a lot of different types of programs. Their number is 800-813-4673. And there's a group called Share, which they are throughout the 5 boroughs. I don't happen to have their number handy, I'm sorry, but if you go online to SHAR, I'm sure there'll be a number that indicates their number that you can contact them, but they do have group support, which was group support outside where you met in a specific location, but I'm sure they have adapted to online support as well during this time of COVID.
Thank you. Yes, everybody's pivoting and making sure that they are providing services in a way that everyone can access now. So thank you for that information. Another question we have is, how can women become informed about breast implants and FDA changes that may impact their health?
I'll take that question, and thank you again for having me on this panel and working with you. So I would say the best source of information is your plastic surgeon. If you have the implants, you should be in touch with your plastic surgeon who put your implants in. Generally, when you have implants placed, they will give you a card that gives you sort of like an ID of the implants, serial number, and has the company that put the interview in. That put the implants in. And also, you know, it's also just good to just stay on top of the news, because anytime there's a problem with implants, that's going to make it into the news. I mean, the main thing right now is that there was a recall on the textured implants that were put out mainly by one company, Allergan. And so it was decided that all of those implants were just going to be removed. And so it's not all the implants, but just the textured implants, because there was a relationship between the textured implants and a certain type of lymphoma called anaplastic lymphoma, which is pretty rare. It's not breast cancer, it's a lymphoma. It just happens to be in the breast because that's where the implants are placed. And so if you have those type of implants, you should have a conversation with your plastic surgeon about having those implants removed.
Great. And so there's another question about a lump in your breast. Can a lump in your breast not be cancer? Can it just be, anything else?
Yeah.
All lumps cancer?
Yeah. So yeah, I mean, to be honest, most of the lumps that we see are not cancer. Lumps can be, there are a lot of benign masses that form in the breast. They can be what's called fibroadenomas. You can have cysts. There's so many pathologies that form in the breast that are not cancer. So you don't have to panic if you feel a lump, but you still need to get it checked out. You still need to take it, have some, if you feel something that doesn't feel normal to you, then you need to check it out. The most common lump that we tend to see or hear about is what we call fibrocystic changes. That usually is like, women will say that it's a little painful, tender. It may change with your menstrual cycle. That's completely normal. And it may just feel not so much as a lump, but sort of like nodular. So it's not a discrete mass, but it just feels lumpy. Completely normal. And so that's why it's good for women to do breast exams, so you know what's normal for you, because most women don't have a nice smooth breast like you see on a model. It usually is lumpy bumpy. That's why you got to know what's normal for you, so that when you see a change, then you know, oh, that's okay, that's not normal. But now you know that, okay, I do have these lumps, that's normal for me. So that when something deviates from that, then you go see a doctor.
Perfect. And so this is the Coping and Caring series. And so how do caretakers help their loved ones? Not only help their loved ones, but how do they take care of themselves during while taking care of a loved one? Of course, they're going to be worried about that loved one. And it can be very stressful taking care of someone who is going through different treatments. And so what were your recommendations for a caretaker to take care of themselves?
You want to take that, Shua?
Sure. I would say to try to have a support network around you. So just recently, I was the caretaker for my dad, who he did not have cancer, but he had a lot of other ailments and needed support. And so for me, I had to rely on my family. So I had to have a sister, and we shared in that. And if that's not an option for you, friends, people are willing to help you if you ask, as well as looking into. Sometimes there are support services. So maybe the person, if they are under medical treatment, you can speak with their doctors, because you never know. There might be a resource where they might be able to have a home health aide to assist them and give them support, depending upon the insurance. The insurance might very well also have some type of allowance that allows them to have some support service from a provider. So you have to use all resources. If they're seniors, check into some of the Department of Aging has a lot of resources and support. So I was able to get some support with contacting agencies such as that. So they actually gave me things, medical supplies, masks, I even got a hospital bed. I got a wheelchair. These are things that we don't know that we can have that is covered in our insurance or Medicare or Medicaid program. So try to utilize all the resources. It's either yes or no. Yes is better, but you don't know what is available to you unless you seek information about it. And that's what I did.
Well, thank you for that, Sheila. I know that oftentimes we don't always think about the agencies that we can use for our own resources because we work for the city. So thank you for that. I think that was really powerful to share. And as a breast cancer survivor, I know you touched on this a little bit, Sheila, in your talk. What kind of health practices are really important to maintain a person's health in the long term? Someone who
So,
has actually gone through breast cancer.
oh, well, I'm not a breast cancer survivor, but in my years of working with women, again, there are resources available. There's financial resources. There are resources that can help you with transportation. There are a lot of organizations that like I said, the biggest support with having a lot of information and resources is the American Cancer Society. So, for instance, there could be a woman that might be under 40, and there is an organization that specializes with women, or not just women, it's men and women under 40, helping with some educational support, resources, also things that dictate concerns towards that age, because there's a difference between say a 20-something-year-old and a 40 or 50-year-old being diagnosed with a grave illness, and they might need a different type of support. As I said, they might be in school having trouble managing that and difficulties. So there are resources, it's just that they're not readily known. And sometimes you just have to, in the age of technology, it helps. You can get a lot of information and resources from that.
Thank you. So doing our research on the computer is really helpful.
Yeah, and again, just aligning yourself up with your medical team. Social workers and navigators might be on staff at those institutions, and we're here. So we try to find answers. If you don't have an answer, my job is to try to find that answer to support you. And I'm making lots of calls and asking for all kinds of out of the ordinary things. And so definitely you can get in touch with the Wellness Program. We're happy to support in this. And this, you do not have to be a part of NYU or change any services in order to get the support from our team. That's the uniqueness of the program that is being sponsored by NYU, is that we are not regulated to just resources of NYU.
Well, that was really helpful to learn. I did put the link in the chat section, so if anyone wants to receive resources from this webinar, please click on the last link. I got the links a little mixed up there, but the last link will take you to our Google page for resources. So we have some more questions. Is a titanium marker left, when a titanium marker is left in a dense breast tissue during a biopsy, can that be harmless, or is that harmless?
Sure, I'll answer that. So yes, the titanium clip is completely harmless. I know many patients are concerned about having a clip placed and whether or not it's going to move, it's going to cause cancer, or it's going to be, I don't know, set off like, I don't know, security alerts or whatever at the airport. It's completely inert. It doesn't cause any, it doesn't set off any alarms at the airport or anything like that. They purposely use, the radiologists purposely use titanium, because if you have to have an MRI or anything like that, it's inert, so it doesn't interfere with that as well. So it can stay in your breast for the rest of your life. It really doesn't cause any problems at all.
Thank you. And so how is COVID-19 affecting breast cancer treatment and mobile units that were available? They were available in the underserved areas, but perhaps they may not be available now.
COVID has impacted this portion of healthcare greatly, but now that there are, controls happening where some of them have not returned, but some are on the road. So we have relationships with those that are on the road and those that are not on the road. So, but as well as most healthcare institutions are back up and running, providing that service. Fortunately for us, while it did kind of make us move around in a different way as far as getting women screened, we were able to just keep running, and it didn't necessarily impair us so greatly. We were prepared to be able to keep moving in the absence of mobile screening units. So we're able to support, and they are slowly but surely coming back and gaining ground back to servicing.
All righty, so we have another question. Breast density, what is it? And does radiation play a part in breast cancer illness? Their concern really is around constant computer work and exposure.
Okay.
I'm wondering.
So, okay, so there's two questions there. So breast density. So breast density has to do with the amount of fibrous tissue that you have in the breast compared to the fatty tissue, because that's, your breast really is composed of the two. And as you get older, your breast becomes more fatty on your and so on your mammogram, breast tissue or fat looks black. And the problem with dense breasts is that when you have more fibrous tissue, it's hard to see something, a problem like a cancer, whether it's a mass or calcifications, because then you're looking for something white on a white background, right? So that's one problem. The second problem is that when you have dense breasts, there is a slight increase in breast cancer risk. We get more concerned when you have dense breasts and a family history. You have to take on a case-by-case basis. Just because you have dense breasts does not mean that you're going to get breast cancer, or that or that the dense breast tissue becomes breast cancer. It may mean that you may need additional imaging, like an ultrasound, to see additional tissue that the mammogram doesn't see. Like the radiologist will say, I recommend an ultrasound. For most women, the risk, might be slightly higher. But to be honest, about 40% of women have dense breast tissue, so it's pretty common. As you get older and as you go into menopause, your breasts become less dense because your estrogen levels go down, and then it becomes replaced by fat, and then it becomes easier to see. And that's actually when most women's risk for breast cancer goes up. So it becomes less of a problem. So I hope that answers that part of the question. Now, as far as radiation, there haven't been any studies to show that the exposure that we normally have in our environment, like sitting in front of a computer or phone use, increases our risk. That being said, I think everyone should just use our judgment and minimize the risk as much as possible. I think so we just don't have any studies to show that. I think that, there are greater risks for breast cancer that we know increase our risk. And I think that if that were the case, we'd just see such large upticks in breast cancer risks. And we just haven't seen that. So I don't see, I don't see any data to support that.
Well, that was comforting to learn, because I know that when cell phones first came out, there was a big talk about,
Yeah, that
radiation.
with brain cancer, maybe, because we were just holding it up to our heads. But I
Right.
don't see that with breast cancer. No.
Okay,
Yeah.
perfect. So what is the difference between screening, diagnostic, and ultrasound imaging of the breast?
So that's a great question because people often, confuse the two. So screening, a screening mammogram or a screening ultrasound, which is what we're actually trying to get women to do this month, and actually every month of the year should be breast cancer screening, is when you're asymptomatic, meaning you don't feel alarmed, you're not having a problem with your breast, you're just going in for your annual screening mammogram. You just want to make sure that everything's okay. You go in and hopefully the radiologist says everything's fine, come back in a year. A diagnostic mammogram or an ultrasound is done if they see something abnormal on your screening mammogram. So you go for your screening mammogram and they see something. Doesn't mean that it's cancer, not necessarily. It's just that they want to follow it up. So the radiologist may say, there's a little something there. We want to get you some additional imaging. And so your doctor will the radiologist will have your doctor order that additional imaging, like, on the right breast, and you'll have to get squeezed again, unfortunately, or an ultrasound, and hopefully everything's fine. Might be just some thick tissue there, or you may need to get a biopsy, but that's what a diagnostic means. It's just, that additional imaging that you get after the screening, whether it's a mammogram or an ultrasound. So I hope that makes sense.
So this person indicates in the chat that they just learned that their sister in another state has been advised to undergo chemo for breast cancer that has recently diagnosed. And how can she best support her? And yeah, how can she best support her? And I guess, because of the distance.
Yeah, because of the distance in COVID.
Mhm, mhm.
I mean, Sheila, maybe you could, I don't know if you want to answer it, or I can answer it.
I'll try. Again, just keeping the lines of communication open. And because of the distance, possibly trying to connect with her friends if she's just in another state where she doesn't have family to support. And if she is in a place where there are family members, she needs to reach out. One of the big things that I find between women, and a lot of women of color and different ethnicities within races, is that we keep secrets and we keep stuff to ourselves because we are ashamed of our situation, and we blame ourselves for something. But a cancer is not something you can control, so there's no reason to be ashamed of it. There's no reason for it to be a secret, and you're actually doing a disservice to your family. I know that there are all types of situations that will warrant that you might feel a certain way about your family, but family can be your friends, So I would say to the person that does not live where her family member is just also just try to connect with other people that are connected to her so that she can get honest answers about how her sibling or family member is doing, and also know that when she might need to just step in and support them. Because sometimes we're not honest. The patient might not be honest with what their true situation is. So it's best to kind of, if you are able to, reach out and see if there are others that can lend support, and also encourage and let them know, assure them that whatever is in your power that you can do this to support, you will, and that there is no hesitation in that, in asking. Asking is the most important thing.
And if I can just add to that, if this person who asked a question can just offer to her sister to just be available to maybe even be on the phone when she goes for a visit to her doctor by phone. I have no problem speaking to family members and just explaining to the family members, what's going on, what the treatment is, and so forth, if the patient gives permission. But the patient has to give permission.
Mhm.
It helps maybe just to do it all at once while the patient's in the room. And so they put the phone on speakerphone. I can just have the conversation all together, so everyone's all on the same page. And then maybe the sister then can feel like she's part of, part of the process.
Yes, that's big. That's major, because
Yeah.
all of that information that you're getting when you're with the doctor is very overwhelming,
Yeah.
and it's a lot to take in. So if there is, I believe that you should always have someone with you. And as Dr. Joseph said, if they can't be physically with you, have someone on the phone that can hear, because you get a lot and you can't take it all in, and then needing to relay what was told to you to someone else, especially if there's a senior, they can't relay it,
Right.
and that just adds more emotional, feelings towards that, because you feel helpless, and the person might feel hopeless, and it doesn't necessarily mean any of those things.
Right. So that's a suggestion. And so, right. And then you also just don't want miscommunication, because what the patient may interpret from the doctor may be completely different, or what the doctor says may be different from what the patient interprets.
Exactly.
So it would be great if everyone could be present, even if she's not there, even if it's virtual. So, because I don't mind talking to a family member at a different time, but then what happens is the family member is like, well, that's not what you told me. I can't be, I can only say this is what I told the patient. And then it's up to the two of them to sort of sort it out. So it's easier if everyone's all together. And here's this information all at the same time.
Well, thank you for that, Dr. Joseph. I know that it's a sign of strength really to ask for help,
Yeah.
and to have a person with you, even if it's on the phone. It could make the patient feel a lot stronger, knowing
Yeah.
that they have that support
Feel
and they have
supported.
that second ear. Yeah.
Absolutely.
Um,
Yeah.
and so another person indicates that they had a hysterectomy quite a while ago, and the ovaries were preserved. They want to know, would that affect any of their risk of having breast cancer?
It all depends on when they had the hysterectomy, but if I'm assuming now the person is post menopausal, so at this point, probably not. I don't think so. I just don't have enough information.
Okay. And is the BRCA gene test covered? Oh, this is a question that this person would have to ask their insurance, if the BRCA gene test was
Yeah,
covered by
it,
their insurance.
that's a good question. Genetic testing should be covered as long as the patient meets what's called the NCCN guidelines for genetic testing. So if there is enough of a family risk to justify genetic testing, meaning that if there are guidelines that we use. And so if whether either the patient has multiple family members with cancer, whether it's breast or ovarian cancer or other cancers that we also test for that have genetic predispositions, or if the patient is herself or himself has cancer and meets guidelines for genetic testing, then it should be covered. But if the patient has no risk factors, it would be, the insurance company may not cover it.
And so we only have a few moments left, so I'm going to take one more question. Is there any correlation between diet and breast cancer? And if so, what does the data show?
That's always a tough question, because I know when patients are diagnosed with breast cancer, a lot of them ask, well, what should I eat? and what should, how do I change my diet? Which I think is a great question. And I always encourage them still to meet with a nutritionist.
Yes.
But there isn't, I personally think it's something they should do, but there isn't any one study that I can say that can say there's one culprit as far as breast cancer is concerned. So I'm of the mindset that it's everything in moderation. I don't think you should be eating tons of meat, red meat, especially. I think you need to minimize that and eat less red meat and eat more fish and chicken and vegetables and so forth. And try to stay away from like things like things that convert food that get converted into phytoestrogens and so forth, like soy products, and just be mindful of that. Other than that, I think people can eat whatever they want. I just think you need to be mindful of that and sit down with a nutritionist.
I think
Perfect.
nutrition is, I always suggest to patients that I support that it's a good, when they start talking about what should I eat, I always suggest to them about seeking out a nutritionist and asking the doctor to refer it, because the doctor will give you that referral for that. And it definitely gives a lot of support and wealth of information that can help you along the way.
Yeah. And also, if I can say one more thing, is to be careful about, I know a lot of people take a lot of vitamins and so forth, or also be mindful about disclosing all of the things you may be taking as well. People may think that vitamins, we don't need to know about that, but a lot of the herbal things that you may be taking and vitamins may also interact with, if you're a breast cancer patient, may interact with your therapy. So we need to know that as well. We're not saying you can't take it. We just need to know because there can be interactions.
Righty. Well, this was a really wonderful information. And I just want to thank you both for partnering with us and sharing all of this wonderful information. I'm hopeful that everyone on the call has learned something new and will share with their loved ones and their friends. Everyone on the call everyone who's registered will receive these slides and can share widely. So I just want to make sure that we touch on the next few events that are coming up so that everyone can continue to take part in the Coping and Caring series. So later on today at 2 o'clock, there'll be a wellness vendor fair, and you can virtually chat with your representative from Cancer Care, Thrive NYC, and Emblem Health. So lots of questions that you had today, you perhaps can pose to Cancer Care as well, and ask your insurance, because Emblem Health is a large provider to most employees. And so there may be some questions that they can answer today as well. And then this evening is a paint and relax. And so you can still register for that. And that's a really, really popular event. And so hopefully you can take part in that. And so tomorrow we start the day with a yoga and meditation, and then another wellness fair. And then at 11 o'clock, there will be a Q&A on landscape and actually a webinar on landscape of gender-based violence during COVID-19. Unfortunately, during COVID-19 has led to a rise in domestic violence. And October is not only Breast Cancer Month, but it's also National Domestic Violence Awareness Month. And you can join this webinar to learn more about the current state of gender-based violence and how you can assist victims. And at 12:30, we'll be leading another live Q&A on building your mental health resilience. And I will be moderating that Q&A with Dr. Rebecca Lynn Walton. She is the Assistant Vice President of Behavioral Health at Health and Hospitals. So we're really looking forward to that as well. In the evening, there will be a color and chill. So there's lots of events going on in the next 2 days. And so please log on and register for what you think is that you would like to participate in. Next slide, please. And so later on this month, October 28th, next Wednesday, there'll be a Let's Talk Wellness Accommodations for Mental Health Disabilities. That will be presented by the Mayor's Office of People with Disabilities. And you will learn more about what a mental health disability is, and they will talk about reasonable accommodations. On November 6th, there will be a webinar on New York City on matters of racial equality presented by the City Commission on Human Rights. And this webinar will talk about racial equality through policy changes and community outreach and the role of law enforcement. So please go to our website for upcoming events and register for the events that you see that you might want to participate in. And lastly, on November 12th, we will be joined again by our resident nutritionist to answer questions about eating well while living with diabetes. And next up, flu shots. We know that COVID-19 has really made it really more and more important to get your flu shot. And so there's 3 ways that you can do it. You can go to the WorkWell NYC clinics, and that's just for employees, or you could take your family to a participating pharmacy or in-network medical offices. And so you will, there's many opportunities for you to get your flu shot, so please do. Next slide. And we have knowing that we are virtual, we have a coping and caring wall. It's a Padlet. The link is here. You can go onto the Padlet and share your best practices of how you are keeping well during this time, and maybe learn something new about how someone else is keeping themselves well during this time. And so I'd just like to thank you all again for participating in this, sharing this very important information. And these are other ways that participants can stay connected with us by joining our mail list, following us on Instagram and LinkedIn. And again, everyone will receive, oh, 1 second, just before we all leave, sorry, we do have a poll question. So I want to launch the poll. We just want to get an idea of what you learned. At least, did you learn anything? Did you learn at least one way to provide support for someone impacted by breast cancer during this talk? So if you could just take a moment and answer this question, we'd love to. Alrighty, so we'll just take one more second. Okay. I think we can end polling. So great. Most people did learn something new, a new way to provide support for someone that they know is impacted by breast cancer. So thank you so much again. I really do appreciate everyone's time. And again, you will receive these slides in the upcoming email. So enjoy the rest of your day, and please join us at the rest of the events during the series today. Take care.
Thank you.